Hi, my name's Vanessa. I'm one of the nurses here at the Cancer Screening, Treatment and Support Service at Palmerston North Hospital. Welcome to this video on how to give yourself subcut chemotherapy. Wash your hands thoroughly with soap and water for 30 seconds and dry them thoroughly. Find a space to work from and clean down the surface. Place the plastic backed sheet down white side up. Take your chemotherapy out of the fridge and place the required dose on the plastic backed sheet. Check the expiry on the syringe has not passed, as well as the name is correct for the person receiving the chemotherapy. Allow the chemotherapy to come up to room temperature for approximately 30 minutes, ensuring that the syringe is left in an area that is out of reach of children and pets. Wash and dry your hands thoroughly. Gather your equipment and place it on the plastic back sheet along with the syringe of chemotherapy. You will need a sharp spin, a pair of purple gloves, a packet of gauze, an antiseptic wipe, and a needle. Wash and dry your hands thoroughly. Remove the syringe of chemotherapy from the bag and place on the plastic back sheet. Open the packet to the needle without removing it from the packaging and place it on the plastic back sheet. Take a piece of gauze out of the packet and use this to remove the cap from the syringe. Screw the needle onto the syringe. While leaving the cap on the needle, hold the syringe vertical and pull back on the plunger to add 0.3 mL of air. The air will not cause you any harm and ensures that the full dose of the chemotherapy is delivered under the skin. Roll the syringe back and forth between your hands until the contents of the syringe is a consistent white. Open the sharp spin ready for use. Position yourself so that you are comfortable and can easily see your abdomen. You may find it easier to be seated or laying down. Select an area on your abdomen that is suitable to give the injection. Ensure that it is at least 2.5 centimeters away from your belly button or any previous sites or any areas that's reddened, irritated or bruised. Uncap the needle carefully. Lift the skin upwards away from the underlying muscle layer. Holding the syringe like a pen, insert the needle into the pinched skin fold at a 90-degree angle in one quick motion. Once the needle is inserted all the way, use your index finger to press the plunger of the syringe all the way in. Ensure you keep hold of the skin fold with your other hand throughout. Once the contents of the syringe is fully injected, remove the needle at the same angle it was inserted and dispose of it straight into the sharp spin. Do not recap the needle. If there is any fluid or bleeding at the site, hold a piece of gauze over the site, pressing lightly until the bleeding stops. Do not massage the area as it can cause irritation. If there is any bleeding, it is usually very light and will stop quickly. Dispose of the plastic back sheet, the gauze and gloves in the purple rubbish bag. Ensure that you store the purple rubbish bag and sharp spin in a safe area where it is out of reach of children and pets. After the procedure is completed, wash your hands with soap and water for 30 seconds and dry thoroughly. Complete the site tracker form by recording the date under the injection number and write the number on the picture to indicate the site where it was given. This helps to keep a record of where you have been, as it may not be obvious when you give the next injection. A few final pointers. Once the sharp spin or rubbish bag are full, seal them off and return them to the pharmacy. If you spill the chemotherapy out of the syringe accidentally, clean up with warm soapy water and notify your hematology nurse. Ensure syringes are stored in a safe container out of the reach of children and pets.